market healthcare program about cash patients and cash doctors, and a kind of a glimpse of where things are going into the future and how Health Excellence Plus is participating in that. Tonight we have a very special guest, Dr. Tony Dale. He's the founder of Sedera Health, and you'll see how he and the organization fits into the whole scope of what we're doing here. And so I want to welcome everybody tonight. We're going to kind of go through part of the setup initially, and then I'm going to, excuse me, allow Tony to take over and kind of explain how that whole aspect of the program works. And real quick, Vincent, you are there now. I see you did successfully get that pin in there, so thank you very much. First off, let me first tell you that if you're entitled to, I'm encouraging you, I should say, to invite people to participate in this program. Just by registering, they're going to get a reminder of the upcoming weeks, and we're booked all the way through November, by the way, on this event. So we've really been getting a lot of people trying to participate. That you will get a notice every Monday that reminds you of the one that's coming up and a link to the one that just was. So in this coming Monday, the link to this particular recording will appear, and whether the person attends or doesn't, they're going to keep getting those notices every week until they themselves unsubscribe. So this is for consumers, for potential clients, for doctors, for Health Excellence Plus members, for anybody that wants to kind of stay up to date on a regular basis on what's happening. Before we get into who's coming up and then we'll get into the program, I did want to relay some other information, because a part of participating in this program, as well as where Health Excellence Plus is situated, is we're really at the cutting edge of what's happening. So we get to find out a lot of things before others do. And we've shared some other resources in weeks past, and I want to share another new one that we've encountered of late. There's another organization, very few people really know about it, though it has made a fair amount of media splash, is openthebooks.com. And this is a way to find out where every single penny, that says every dime online in real time. So everyone's salaries, budgets are spent, bureaucrat, every single thing you can imagine. And we saw some stuff about it today that was absolutely mind-boggling of what's going on. But what was pertinent to us, because we're talking about healthcare, was that the federal agencies, and this is pretty unbelievable, not only are they wasting money, but that they're making improper payments, and it was $1.2 trillion. But here's the part that's pertinent to us, and you'll want to see through all of this. But let's jump to this chart. So here's the top 10 programs with improper payments. So look at the top couple ones right here. Medicare. So they've overspent $387 billion. Like I owe you $1,000, but I sent you 5,000. So this only represents where they're overspending. This has nothing to do with waste. So look at like Medicare Advantage and Medicaid and all of these things that are related to the healthcare industry that is all squandered, that is not paying or helping any one person get any health care or get any help for their health. So be cognizant of this. I would tell you to come take a look and search around on this site, openthebooks.com. It's a pretty remarkable thing. You're going to see a lot more happen with it in the coming months, and we'll keep you posted on it. And it is pretty amazing. So on that note, let me shift back into the program at hand and kind of let's get going what we're going to do here first. So first, before we get started, I definitely want to kind of advise you that, again, this is just a very nice overview program we're going to cover, but we're really going to dig into some topics that are pertinent to the program itself, and that's really the purpose of this webinar. So on that note, this does not represent a full presentation by any stretch. You're going to want to read all the program documentation and make sure this is a good fit for you. You want to follow up with the person that directed you to be here to get the full breakdown on every feature in the program, and they'll make sure that you are selecting the right version, and that it will be a great fit for you. Every week, we will be explaining the way that Health Excellence Plus pulls your whole healthcare world together with the help of a variety of medical professionals, medical association leaders, and industry leaders to help keep you at the front edge of what's happening in healthcare today, just as I showed with that Open the Books is a good example. So here's the main thing that we're working on. The fact that Health Excellence Plus is a healthy care strategy. And so the reality of that is we're trying to tackle a lot of different things, because like in any strategy, there's a lot of elements that make it up. But these are the biggies. The fact that the prices have been crazy, that there's no really reward or tie into the patient in terms of the way healthcare is paid for traditionally. Networks, which totally start to control your ability to make your own decisions and have access where you prefer. Inability to get all of your medical records. Everything's become firewalled and separated, and some's over here and some's over there. A lot of time wasted in all facets of the industry from the consumer and patient standpoint, and that there's nothing personalized about the whole program. So those are what we feel are the most important things that we're going to address. As a fast overview, like I said, this is just an overview of the presentation of the product. There's 5 basic programs. We're emphasizing on this series the one that uses the cash patient, cash doctor model, or the direct primary care physician as well. But we also have ones that are HSA compatible, that are self-directed, that are kind of a virtual DPC type model. So there's options available to you. Some of the biggest part of this strategy is the idea of avoiding problems. So that's where the wellness and the concierge and all the rest of what we've got comes into play, is to prevent you from needing the rush to the emergency room and all these other things that could befall you if you're neglecting your health and functioning in the current contemporary format of sickness care. We're not really worried about whether you're healthy or not. We're just waiting for you to have that heart attack so we can all jump in there and show you how awesome we are. And that's the idea of the preventative and the telemedicine. And then when we do want to take advantage of using the hospital, something costly, we're going to want to take advantage of medical cost sharing as opposed to the broken model, which is health insurance, which we are decidedly not. You can also have the luxury of being able to do tourism, either around town, across the state, across the country, across the world, access to other treatments and modalities you wouldn't normally get a chance to work with, the ability to make sure you know what your costs are, and also having some financial tools available like health savings accounts or health matching accounts to allow you to be able to pay for some of the things you are going to encounter. Now, so here we are, we're seeing the whole strategy. And the part that most people focus on is at the bottom in gray called contain, because that's all about the large medical costs. And that's ideally what insurance is largely just there for, and not much else. So, but that's like in our mind, the last thing you want to resort to. The goal is to avoid having to get to that level. And so we're going to start out and let's briefly breeze through this, and then we'll shift gears when we get down to that contain to let our guest of honor have a chat today and explain to us how that part works. So the most important things, we want to avoid everything. So in that area, we've built in a number of tools to help you do that. You're going to also have your own medical vault. So as we said, your records will be in a good place. You're going to be able to assess your health conditions so you can figure out what you want to do and what you should be doing to prevent that situation. You're going to also have a special membership card with us, which is going to allow the first responder, emergency room person to see that aspect of your medical records that they need to get access to in case something happens to you and maybe you're unconscious and can't talk. Then we're going to have some preventative stuff that would typically be, you know, your annual checkup or any other kind of tests, colonoscopy, things of that nature. And if you have a direct primary care physician, then they're going to provide those aspects of the program. Again, this is why we have different ones. We're going to want to manage things if something do happen. So we're going to give you the ability to, off your membership card, not only can that first responder access it, but you're going to be able to have a phone number on there that you can call to get to your own personal concierge to assist you if something's happening to you at the moment and I don't know what I should do next type of a situation. Or I've been told I should go get an MRI as an example, and I got a few weeks to do that, and I want to get a better price on one. So I'm going to have all these tools at my hands, and then as I mentioned before, the health matching accounts, and that's going to be a way for you to build up medical expenses as an adjunct to the program. And then we want to mitigate it. So if things start to escalate a little bit more, like suddenly I get this scratchy throat in the middle of the night, I'm going to be able to call in and talk to my 24-hour-a-day doctor service so I don't have to rush out to the corner because maybe it's a false alarm, or maybe it's pretty bad and I have to go to the emergency room, or maybe you can wait till Monday, or maybe that teledoctor could just phone in a prescription for me and the whole problem's resolved 1, 2, 3. I'm going to have the ability to get second opinions. So if I have a problem with my back, as an example, and some surgery, you know, proactive place is telling me I got to get surgery right away, I'm going to be able to find out if that's a little bit too premature. Maybe I can make with some exercises or a chiropractor or some other modality before I have to jump into surgery. So, and we're going to reward you because, as we said, we want there to be, you know, incentives for the patient. So in that instance, whatever you would normally owe on that portion of the bill of yourself, let's say in the program where you're going to pay $1,000 of that big bill, you only have to pay 500 of it because you had that second opinion done. And then we're also going to give you global access to medication, because to be in control of your medical destiny, you need to be able to get access to all your resources. And in the typical world, you're stuck with a built-in little drug card, which is forcing you to pay astronomical figures when some of these medications are available elsewhere at much better pricing. And you're going to have access to that as well. So I did a very quick breeze through on that on purpose because I wanted to leave the maximum time here to start to talk about this containment feature. And this is where Dr. Tony Dale, who is the actual founder of Sedera Health, the partner with us within this component, for him to cover his aspect of the program. So on that note, Tony, if you would just first off give us a little background on yourself for a quick minute, and then let's jump into this.
Okay, well, Jeff, I'm happy to do that, and thank you so much for the opportunity to share with everybody this evening. Now, of course, I haven't had a chance to meet all of you who are on the line, so I don't know exactly your background or your interest in this seminar. So what I plan to do is perhaps take the next 20 minutes or so to give you a little bit of an overview of some of the areas we're involved in and how that ties in with, you know, what Health Excellence Plus is doing. And then we'll open things up to questions so that you have, you know, plenty of time to raise specific questions if you want to. Well, first I should tell you, I guess, a tiny little bit about myself and how I got involved in this. I happen to be a British physician. I was in family practice for many years, trained at a very famous British medical school. I sometimes chuckle. I tell people that we get a little bit of a sense of the comparative histories of the two countries when I tell you that the medical school I went to was established in 1123. There's actually a plaque on the wall of the sort of main hospital area as you go into the main courtyard saying on this spot William Wallace was killed. So any of you who've seen Braveheart have actually seen, as it were, a section of right where our hospital is. My family practice background in England and experience in the British National Health Service meant that when I came over here, I'm not really tied up with clinical medical things, but with other work I was doing with physicians, I was not very knowledgeable about the American medical scene. And so my first direct introduction to that scene was when I injured my knee, trying to pretend I could keep up with my kids on the basketball court. I needed some minor surgery. It was essentially outpatient surgery. You know, I went in at 6:30 in the morning and was sent home by 10:30 that same morning. And the surgeon had told me it was going to cost about $2,000. Surgery went great. But when the bills began coming, it wasn't $2,000 that came. It was actually almost $15,000. And that was back in 1996. So that would be about the same as saying it was $35,000 in today's prices. And I just said, this is absolutely nuts. You know, I could have flown over the best known orthopedic surgeon in England. We could have taken over the top floor of the local Hilton Hotel here in Austin, Texas. And I could have done everything for less price than that. So I began looking into what was happening. And trying to figure out, you know, what was the system really that messed up where the pricing could be so extraordinarily high, or what was happening? Well, what I found out was that the system really is that messed up. Nobody really knew or understood about medical pricing. The doctors didn't know, you know, anyone else I spoke to. And equally extraordinary was when I challenged the prices, almost all of the providers just folded. Now I'm not a poker player, so I don't know, you know, exactly why they folded and were so willing to talk a more sensible price. But just literally by challenging the price, I brought all of my costs down by 50%. Now, if I'd known more, like I know now, I would have never settled for the 50% off, because the truth is, when you begin looking at what a fair and appropriate pricing is, you know, typically that's at least 50%, and many times it is more. And this is kind of a backdrop to some of the things where I'm going to go in a moment in this presentation, because you have to understand that medical pricing in this country bears no relationship to your experience of medical pricing elsewhere. I mean, try and imagine if you wanted to buy a car, which is an expensive item, which is the sort of thing that one doesn't do often, rather like large medical bills. You don't expect them to happen often. So, you know, most of us aren't expert in buying cars. But we know we can shop around. We know we can go on the internet and look up prices. Even when we go somewhere, we know the sort of games they play with us, sort of good cop, bad cop thing with the salespeople and the sales managers, so that they induce us to buy. But the truth is, whether you buy your Ford Explorer or, if you can afford it, your Maserati, whatever it might be, um, it's not going to make a huge difference where you go. On a $35,000 car, it might cost $38,000 in one place if you don't know how to negotiate. Maybe you're a great negotiator, you can get it to $33,000 somewhere else, but it's all in the same ballpark. That is not the way it is in the medical world. You can go to one hospital in one part of town and have your hernia repaired, and maybe they charge you $5,000 all included. The surgeon, the anesthetist, the labs, everything. You could go to another hospital in town, and you might pay as much as 6 or 7 times as much. That might suddenly, the $5,000 operation at one place might be a $35,000 operation at another. And you're saying to yourself, is this possible? Oh, that must mean that the second hospital where it's 35,000 is doing a much better job. Okay, let me just help you understand. There is no guarantee that the hospital charging you 35,000 instead of 5,000 is doing a better job. In fact, on the contrary, our experience working in these areas, for the last almost 25 years now, is that there is no correlation between cost and quality. None. Typically you want to buy some knives and you think, I buy a $50 set of knives, they're probably better than a $10 set of knives. And they probably are. That does not apply in healthcare. There is no guarantee that just because you're paying double or triple or 5 times the price that you're getting something better. I mean, if you look at something as simple as an MRI, which is a type of radiology, treatment, maybe you've got problems in your shoulder, or in my case, it was in my knee, and, they're trying to see exactly what's going on. The same equipment is going to be used in the hospital as is used in the freestanding radiology unit on the other side of the street. But in the hospital, you might pay to have that done, and you might pay $3,000. And you go to the freestanding radiology unit, and you might pay $350. Okay, this is completely immoral at its core. It's unfair to the patient, and it traps all of us in a position where we have very few ways for most people to understand, am I getting good treatment at a fair price? And so sort of skipping the 20, at this point, 3 years since I injured my knee and began investigating how to help people and companies and insurance groups and Christian medical sharing programs. 23 years ago, I knew nothing about this. Over the next 20 years, we helped negotiate billions of dollars of bills on behalf particularly of insurance companies and of the Christian healthcare sharing ministries that you might have heard of. And then the Affordable Care Act comes in, and out of that, I saw that what we really needed to do was just help people understand there's a completely different way to handle these big bills. So now let's start with the slide that you can see right there in front of you. If I was trying to summarize what it was that we wanted to accomplish, I wanted to find a way to promote individual ownership. Now, what I mean by that is that each one of us as consumers takes responsibility for what we are purchasing. If I decide to buy, a new cooker or a new car or whatever it is, I take responsibility for that. I shop. Okay, we want people as consumers of the healthcare system to choose to take individual ownership, to take responsibility. And that goes for more than just the responsibility for where they go and how they get their healthcare provision. That means personal responsibility for healthy decision making. If you knew that 70% of all the money spent on healthcare in America is spent on chronic, non-infectious conditions, things like type 2 diabetes, like obesity, like lack of exercise. These are personal choices. And so if we're serious about, containing medical cost, then it does start with personal responsibility. And so as I was thinking through how can we really change the system and help people come to a place of seeing the massive savings that are available to them, let's start with personal responsibility before we go and tell everybody else that they have to change. But let's go on then to and direct access to quality health care. So how do you get direct access? I mean, that cartoon, it's kind of a silly cartoon there in the middle of, at the bottom of the slide you're looking at. The doctor is, struggling to see because in this picture, the insurance company is in between him and the patient. And, whether it's an insurance company or whether it's the government through Medicare and Medicaid or, Veterans Administration type, TRICARE things, when you have someone who is in between the patient and the doctor, and obviously as a family doctor, I feel very strongly about this issue, you actually change the whole dynamic of that relationship. Because all of a sudden, if you ask yourself in that cartoon, who is paying the doctor? Okay, the answer is the insurance company or the government. In that context, the patient doesn't experience the sense of exchange of value. Oh, but my employer is paying for it all, and this is all mine by right. It's through my employer or it's through the government, and so I don't really care what it costs. And on the other side of that equation, the doctor, he almost doesn't care. Not only about what it costs, but whether to make sure he's really providing the best possible medicine. Now, obviously, I'm not implying that all doctors are badly motivated. I think most of them really want to do the best they can. But the system pushes you to where you're on a treadmill just seeing as many patients as you possibly can because your incentives have not been aligned correctly. There's no exchange of value between the patient and the doctor. And that exchange of value is what provides direct access to quality health care. And you heard Jeff briefly mention that, within the Empowering Benefits Health Excellence Plus program, they're encouraging things like belonging to a direct primary care practice. These are membership practices where in exchange for a relatively small monthly fee, sort of, the price of a Starbucks coffee on your way to work each morning, you can actually have unlimited access to a family doctor who's only looking after 500 or 600 patients instead of 3,000 in the typical insurance practice. And when the doctor has that few patients, but a steady income coming from the membership fee, the quality of medicine that is practiced is just remarkably different. So we're promoting individual ownership and direct access to quality healthcare through a sharing community. There's that sense, on the bottom right of your screen of these, people all holding up their money because they've chosen. They're not being forced. This isn't a government mandate. There's not some sort of fine. Thank God that, the individual mandate penalty is gone. But now responsible adults can choose, and I don't mean to exclude the children when I say responsible adults. I'm just recognizing where the decisions are made. And so, people, families, employees in a company, whatever it may be, can voluntarily choose to associate and to have highly organized ways that are going to deal with the major medical bills. So let's go to the next slide, Jeff. Okay, now the next slide sort of emphasizes what we all know. Costs for healthcare have absolutely skyrocketed. Now, if you think about what insurance is supposed to be for, I'm guessing all of you listening to this, this sort of podcast, or whatever the technical word is for what we're doing, this webinar, you have insurance in various places in your life. You have insurance so that if your roof gets blown off, you get help on replacing the roof, because that's expensive. You have insurance to look after your car in case you have an accident. We're used to insurance where the ideal is we pay for the insurance and we never use it. I've had insurance for, I guess, the last 40 to 45 years on my home, and I've only ever used it once. And I don't feel cheated. In fact, I'm delighted that I only had to use it once. And I feel like I had a really good exchange of value, because insurance is designed for unexpected things, which are very expensive, where it makes more sense to find a way to pool all of that risk and only pay money out at a reasonable rate when that situation happens. And in an insurance exchange type system, there is a transfer of risk. That's completely different to what we do. We bring together people in a voluntary association where they're choosing to help others in the community on a voluntary basis to handle the big bills, because health insurance has long since stopped being what most people think insurance is. Health insurance has no relationship or I shouldn't say no relationship, but limited relationship to classic insurance models. Instead, it's become an extremely expensive way of prepaying for medical expenses. And actually, I would suggest that in the hands of well-meaning people in the government, I think they desire the best when they pass the laws they do and this sort of thing, and they think they know better than just letting the market have its own way. But the result of the sort of systems we have, of which the ACA is, the current sort of iteration of what government has foisted on us, is that we find ourselves paying in the most expensive manner possible through, insurance premiums and taxes and all of that, for a very inefficient way of delivering healthcare, even as Jeff showed at the beginning of this, when he showed the hundreds of billions of dollars that have been wasted in misappropriated payments. And so we're trying to say, no, there are much better ways if we just learn to trust each other and work together. And in these better ways, you get access when you need it, and the frustration of the incredible cost. I mean, really what's happened over the last 7 years has been a huge experiment in social engineering to see if it works to force everybody to buy something which lots of people don't want to buy, which companies have been forced to provide for their employees, and all sorts of things like this. With the end result that the premium cost for almost everybody nationwide has doubled at least over the last 7 years, in many cases gone up more than that. And that's so much more than salaries have gone up. So let's go to the next slide. And here, I want you to begin to understand really the fact that this squeeze of medical cost is disproportionately hitting the ordinary consumer. Because whereas you can see the sort of blue part of that graph, which has climbed most rapidly, is the sort of employee cost within the health system. And in the green, you can see the sort of overall growth in cost. And then in the purple, you see the wage growth. Well, no wonder everybody is struggling. And what's happened over the last 7 or 8 years is that really there's been a massive transfer of wealth from the ordinary hardworking person who's struggling to pay for a premium, which even when they've paid it, they now have such high deductibles that they're effectively uninsured. They're not uninsured. It's become normal to think, oh, well, I've got my individual deductible of 5,000, maybe it's 12,000 for my family. But people are functionally uninsured because in that context, they're left in a place where if they did have a medical bill, the sort of more ordinary stuff, maybe something that cost 1,000, like a badly sprained ankle at an emergency room, or something that cost, 3,000, like a broken bone, or, maybe a bad stomach bug or whatever. People have to pay all of that out of their own pockets on top of their premium. Their insurance is not helping them. 19 out of 20 people with a high deductible insurance plan get nothing back really from their insurance company unless they end up with some really major expense. And so we found this very ineffective way of really trying to deal with what should be dealt with, which is just the really high costs. And so let's go on again to the next slide. And this is how we tend to try and put it. We all need access to healthcare, but health insurance is just one way to pay for it. Jeff, let's again go on to the next slide. Now, I want you to put this in a context that you're all familiar with. If you went back just 13 years, okay, to 2005, I'm guessing that everybody on this call was already way, into their adult life where they were understanding basic economics. Back in those days, if you wanted to get somewhere, you could basically go by car, maybe by bus or by train or by taxi. And of course, long distance, you could fly. Okay, but if we now look at what technology has done to change that, I live here in Austin. I mean, obviously we've got Uber and Lyft. Most places have Uber and Lyft. Maybe you've got Car to Go, which is, where you pick up a car in one spot and drop it in another. Yeah, you've still got the taxis. You've still got your own car. But then we've got motorized scooters. We've got thousands of motorized scooters everywhere for all the short trips downtown. We've got all sorts of other approaches which make it possible because people have learned that they can choose to share in the resources that are out there and which they're used to using. And so we have what's known as the sharing economy, which has made it possible for people to take, an asset they have and make it available. So one can be an Uber driver with your own car, or I need a taxi and I need it now. Well, in the old days, I had to either book it in advance or call the taxi company. I had no idea if it would take 15 minutes or an hour and a half before they came. And, the taxis, to be honest, weren't particularly nice and were often dirty and this sort of stuff. And now all of a sudden, the open market, the sharing market has made it so easy to travel. Well, now, next slide, exactly the same thing is happening in the medical world. When the pain gets big enough, people begin to find creative ways to handle things. And that's really what's happening. I mean, we were all used to the fact that 10 or 15 years ago, you maybe had your doctor, you could possibly go, there were some urgent cares beginning to appear, you could go to the hospital or to the emergency room. And that's really what we thought of. But now so many things are changing. I mean, the direct primary care model is one of the most radical changes going on of patients having a true medical home with a high quality family doctor who's only looking after the number of patients he can look after at an incredibly reasonable price. Most DPC practices are charging around $75 for a person, and that's just awesome. Okay, but it's not only in family practice this is happening. And, in this slide, I mentioned that many specialists, the direct pay specialists, are opening up in these areas. Here in Texas, Green Imaging is just an incredible example of what is going on in the direct pay specialist world. Now, this is where if you want an MRI done in Austin, okay, you can go to one of the local hospitals and pay $3,000, or you can go to Green Imaging and pay $350. Well, why aren't we all aware of these things? Well, a few years ago, these options didn't exist. But what's happening is that all sorts of people are getting absolutely frustrated with the way the healthcare industry is functioning. And they're saying it's not just inefficient, but it's actually immoral. There's something wrong when people are being grossly overcharged. And it's not just doctors who are waking up and saying that. But if you look here on this slide over on the right-hand side where I've mentioned Health Rosetta, these are large and growing groups of brokers. This would be people like Empowering Benefits, who have put on tonight's program and who are the people who have created Health Excellence Plus. They know that the system is flawed at its core and that we have to find completely different ways of doing it. And different ways are emerging all over the place. Free market surgery centers are cropping up where they're absolutely open and transparent in their pricing. And when you go in, it's not what's the anesthetist going to charge me in the lab and the x-rays and the surgeon, but no, you're going in to have your appendix out, it's going to cost you this. And this is usually about 1/3 of the cost of having the same procedure done by the same surgeon at some hospital that is not open about pricing. So let's again move on to the next slide. So really one needs a vision of how things can change. And if you go to the next slide again, what I would suggest is right now in 2018, that little blue square in the corner of the larger red square for 2018, and when I produced this slide was just last year, which is why it doesn't say 2019. The impact of all the things I've been talking about is tiny. With over 1 million people, or probably nowadays approaching 2 million people within the sort of medical cost-sharing environment, still the vast majority of people have never heard of it. Here in Texas with 25 million or 27 million people, if there is one person in 100 who knows that something like Green Imaging is available to them and they could get fair prices on x-rays and MRIs and CT scans and all of this, I'd be surprised. Maybe it's only one person in 500. So right now, we may not be having much impact, but our goal is to make high quality, human, transparent solutions the new normal in healthcare. Folk like you and I, folk like Health Excellence Plus team, are the ones who are pushing the environment in such a way that slowly we're going to be able to teach the whole country there's a better way to do this. So if that's what our vision is, let's go to the next slide and see the sort of values, because that defines who we are. And Jeff, let's go on again to this last slide of what I'm going to share. Within Sedera Health, and obviously I've not made any real attempt to explain exactly how we do things in Sedera Health because it's such a change. I would prefer you spoke to the folk at Empowering Benefits Plus and work with them and understand how the Health Excellence Plus approach has really revolutionized things by understanding how you can bring things together in a coordinated, putting the parts of the puzzle together. Now, the part of the puzzle that we deal with in Sedera is how do you deal with the big bills? And what we've found is that we can take our values, which are that we're community builders. In other words, the community is at the core of what we do. We believe we can share together and trust each other. I'm trusting you that every month you'll give the share that you committed to share. so that anyone within the community who's having a medical bill that month is going to have it paid for. If I tell you that something like 99.9% of the people in the program do that, you know the program works well. We need a community, okay? But it's not just the community, because we view ourselves as solution shapers. I don't mean us and Sedera as a company. Yes, we view ourselves that way, but we view each of our individual community members as a solution shaper, as people who are talking to others, who are letting them know that we can change the way healthcare works. Okay, so we're really change agents. And you know, in that sense, we're taking responsibility for ourselves and for our own health. We're choosing to be healthy. And when we choose to be healthy, we reap the benefits, not just in our health, but in our pocketbooks. You know, I'm 68 and I'm very blessed. You know, bad things could have happened to me. I could have had a cancer or all sorts of things. But my typical, you know, expenditure for health benefit in any given year, apart from what I pay for belonging to Sedera, is maybe a few $100s, you know, occasional over the counter something or whatever. Because for many, many years now, and I've been blessed as a physician knowing and understanding this stuff, I've chosen to be healthy. I choose what I eat. I choose, you know, my exercise. So, you know, when we do this, what's happening is the fourth quadrant there, which is that we're not sticking with the status quo. In fact, we're saying we're going to be a part of the change that we believe needs to happen. Now, for Sedera, I knew in my own life, and as I looked at myself, at you know what it meant to be a whole person, as I looked at how I tried to look after patients in all the years I was involved in clinical medicine, that the only real way you can live this is if you take love seriously. And some people say to us, "Oh, come on, you know, you can't talk about love in a business." Why not? Southwest Airlines does. And they, based on their love mantra, have been able to become by far the most popular airline in the United States, even while giving people fair, reasonable prices and you know, very consistent expectations. And for us, we take very seriously that what we are doing on behalf of the community has to be expressed by being rooted in love, which means we're going to treat everybody in the community through what we do in Sedera the very way we would want to be treated. You know, when Jesus gave us the golden rule, you know, however that goes, that, you know, do unto others as you would have done unto yourself. I think that sort of encapsulates how we believe the medical system, including the medical economics of taking care of big bills, can be handled. So there's a whistle-stop tour of what's going on in the free market, a little bit of understanding of what we're doing in Sedera. And Jeff, I'd love you to open this up to people who have questions.
Yes, definitely. Let's do that. I'm going to ask everyone to use that raise your hand icon so that I can call on you to ask questions. And before I do, I just wanted to comment that thanks very much for doing this. That was a very nice stroll, like you said, through all of the aspects of it, because you know how the sausage gets made is less important as to why we're making the sausage, and the pretense of understanding that it is based in love, because realistically it is. I mean, whether the person wants to call it or recognize it or whatever, they think it's corny, that this is such a different business model in insurance. You know, like when you're describing if you have that home problem, you know, it's like, oh honey, if they break the roof, maybe we can get a free deck out of this too. You know, we're trying to get over on the situation, but here, because we're mutually coming together, you know, and that's the paradigm shift. And that's why it's funny, what you're doing in your microcosm is no different than the Health Excellence Plus at large, because that's all based around love the same way. I mean, everybody's in there trying to make each other have that best experience. So it's not a, you know, zero-sum game, it's a win-win at all times. So that is fantastic. All right, let's take some questions here. Kathy, I see you here. I've got you unmuted.
Hello?
I hear you. Go ahead, Kathy.
Okay, along the lines of that last graph and everything you showed, one of the things I strive to do through my own blog is to let people know that there are solutions out there. Sometimes I just feel like it falls onto deaf ears, though. I feel like, I feel kind of like, I try to promote this kind of stuff, and yet, on Twitter, you get all sorts of arguments from the socialists and everything. But how do you really push the idea? How do you really keep pushing so that it will be, recognized someday?
There was an Austrian philosopher back in the last century who was really kind of a radical person. And he was asked by some of his followers, well, if you really want to change society, how does this happen? Does it happen sort of slowly through some sort of renewal, or do you need to have revolution? And he said, well, actually, I don't think either of those is the best way. He said, we need to create an alternative story. And that's really a part of what I've tried to do tonight, is to tell a different story. We're all used to the problems and, the politics and all of this type of thing. And the system is a mess. So we start telling a story of what's happening outside the system and the incredible things that are emerging and the extraordinary savings that one can make. And as all of us talk about this story, it begins to gather momentum. The first time someone hears about Sedera, they tend to think it's too good to be true. And then, one of their friends tells them that they're a part of it. And, it's worked really well for me. And then they hear from some other source, or maybe, they see an ad or something. All of a sudden, they hear about it 3 or 4 times, and the story is changing. And I would encourage you, keep up what you're doing. And all of us on the call, let's take responsibility that, the government isn't going to be our savior here. And from everything I've seen, neither are the insurance companies. We need to step up to the plate and say, I'm taking responsibility. I'm going to be a part of the change that I want to see happen. And slowly but surely, we're going to change the system.
Yep, it's just a growing audience as time goes by. Colleen, I see you have your hand up. You have yourself muted. There you are.
There we go. Thank you very much for your not just your presentation this evening, but the vision that you had many years ago. I appreciate the work that you're doing, and it just takes someone to make a stand. I happen to be in Peoria, Illinois, and very familiar with Samaritan. And I'm so excited to be able to offer Sedera to groups, whereas there's many of us that are very familiar and friends with many Samaritan, folks that, work and do this. And many employers lament over, my goodness, I wish I could do something like this for my employer group. But as an employer, you have, much less influence or control over the thoughts and beliefs of your employees. So this makes the same concept available and starts to convert all of us to consumers in the cash healthcare space. So I'm so thankful for this opportunity. And I really appreciate what you just said about the story. One of my favorite authors is Malcolm
Malcolm Gladwell.
Yes, well, yes. And I love his book about David and Goliath, and it's an application of that story to business and how we don't really have to make a scene here. We just need to start. And if we just start and we just do and we just become what it is that we think is best, then it will occur without any fanfare. It will just happen. And I believe that is happening. And I just am very excited about this, shift. I happen to be very involved in the Free Market Medical Association, and I spend all day, every day, talking to people in all aspects, from the payer side, the provider side, and the employer side, as well as, of course, the consumers. And this is just an excellent product and belief system, and the personal accountability is powerful. And as soon as we begin there, and there's also a variety of other models, like your where when you look at Lyft and Uber and so forth, I think that, we've tried to do a variety of barter systems in the past, and, the government gets involved in that, and how do we tax it? That's actually a sale, for example. But this sharing piece really just becomes a very similar mechanism for how do we band together and be each other's brother's keeper to make sure we have the things that we need without further abuse of the system. So I appreciate it, and I'm very enthusiastic about what this might mean for us in years to come.
Well, thank you so much for your kind comments. And yes, I know Samaritan Ministries and Peoria very well. For the last 18 years, another of our companies has handled a lot of their medical cost containment work. They're very good people. But you actually put your finger on what was perhaps the key issue for me as I looked at what was going on, and that was we needed a way to take this methodology to everybody. It's wonderful to bless people of faith. I'm a person of faith myself, but I think that we have an incredible opportunity to share love by showing that this can work for anybody who's willing to take personal responsibility.
Very
Absolutely.
good. That's great. Paul, I see you've got your hand up.
Yeah, I was just, Tony, I was wondering on the chart that you showed, the Oklahoma Surgery Center and Green Imaging. You mentioned Health Rosetta and SteadyMD. Could you explain who they are?
Health Rosetta is a large, fairly well-known national group of brokers who work in the large self-insure market. And they're one of the people, very like Empowering, Jeff and his team at Health Excellence Plus, their technical name is Empowering Benefits. And so they'd be very similar within their own space, meaning they're showing people that there are much better alternatives. SteadyMD is one of the emerging DPC practices, but it's developing a virtual DPC approach, and it's very innovative. And I just love the fact that what's happening is experimentation, which is working well.
Very good. We got time for one more question. Joan, I see you've got your hand up there.
I do. I just unmuted myself. Hi,
Okay,
Dr.
great.
Jones. Joan Phelps, how are you?
Good, thank you.
Great. Your presentation was excellent. It was so wonderful. I really, really enjoyed it. I just wanted to ask you, I know that as a team member, that Sedera focuses on employer groups. And I am so excited about the blossoming, burgeoning, whatever you want to call it, of the DPC movement. I'm very excited about that. I wanted to ask you, what is your perception of the employers in terms of, taking on a DPC type of program for their employees?
Okay, we very strongly favor that approach because it makes a huge difference to the employees' ongoing health and the amount of money that they will spend on health if they have a really solid family practice that they're a part of. And so DPC is such an excellent way that we actually reduce the cost of the medical cost sharing that we provide. So for employers who make DPC not just available, but whose employees actually become a part of a DPC practice, we reduce the cost of the medical cost sharing to help effectively subsidize the cost of the DPC.
And do employers truly understand the value of the DPC practice?
Employers, generally speaking, understand hardly anything. and
That's your job.
I don't
The salesperson's job is to make them understand it. We're gonna cut that part off. I'm gonna squeeze one last question because we're really up against the time slot. James, I saw you had your hand up there real quick.
Hey, thank you so much. I really appreciate it. I was afraid I wasn't going to get in. Yeah, I'm a DPC doc, actually.
Awesome.
Yeah, thank you. I think I might have met you. Were you at the Nuts and Bolts conference last November?
Yes.
Yeah, I met you very briefly at the very end. So, I mean, just a quick comment on the slide, something happening in healthcare industry. When you had us all together, I kind of got the impression that it looked like we were in competition, but I think we're actually kind of fall under your umbrella, sort of loosely working for a Sedera type thing, not really working, but I mean, actually, it's your kind of organizations that kind of, make us thrive, and vice versa. I think we help each other out a lot. But I have a,
completely agree with you.
yeah,
Absolutely. We need each other. We're not in competition. That's why I put all those different things up there. I love all of them.
yeah, and I really love your model as well. But I have a question. Out of a population of almost 2 million here, I'm the only DPC doc here, and I'm going to open in about 3 weeks. There's only one independent radiology group here, and I called them today and I asked them for a price list, and it was like I was speaking another language to her. So how do I approach these guys, to negotiate, to get the conversation started?
That's a really great question. And because it's so specific and I know we're out of time, do you know how to contact me?
No, sir, I do not.
I have the ability. I'm in touch with Dr. Tinsley, so I can follow up there with him for you.
Yeah, ask him to reach out to me
I
privately,
will.
and I'll happily answer his question.
Perfect.
Yeah, there's one more DPC doc on the other side of the river from me, and her population is even bigger. And since they had that response to me, I don't think she's actually talked with them. But I don't think anybody's bargaining with them, or just nothing's happening here. And we got a very large population.
I'll happily give you some ideas. And one of the things I'm thinking that we need to do is I'll put you in touch with the founder of Green Imaging, and she'll give you some hints on how to break into that world.
That would be fantastic. My patients would greatly appreciate it as well. I'm working part-time with a Medicaid clinic, which I do really enjoy. And these patients are using this radiology center already. So I have some contact with them. But I think it would also save them a lot of money. And I've been teaching them for the last 4 months how to shop for things. Like I've been showing them how to use GoodRx, and I've saved them thousands of dollars in the last 4 months.
Absolutely.
Dr. Tinsley, I'm going to interject here because we're definitely on our time limit.
Yeah, I'm sorry, I didn't mean to run long.
No, I mean, we can talk for hours, as you can see, because things are happening. And as everyone is witnessing, we make sausage on this conversation, and that's the goal.
Yeah, I just really try. I think once I get established, I think others will follow me here.
Absolutely. And then, again, that's just like anything. You're one of those first guys out there. And like Victor Hugo's great line, no idea could be stopped when its time has come. And we're approaching that. Charles, I want to ask if you'd close us out here at the end, just to list who's coming up so we can get everyone excited about the coming Wednesday events.
For sure, Jeff, and thanks, Dr. Dale. This has been fantastic. One of the Uber type entities you showed in your slide, the Texas Free Market Surgery Center, is run by Sean Kelly, and he is our guest next week. So every Wednesday at 7 Eastern, we have a national health leader. So tune in back next week for price disclosed surgery, how that fits into the free market patient. And then the next 3 weeks after that, we have our wellness vendor from U.S. Corporate Wellness, Brad Cooper, talk about personal responsibility. And then someone who did ask a question tonight, Colleen McMahon Ingraham, is going to guest host on organizing all the entities in the free market revolution from the Free Market Medical Association in Illinois. And last but not least, a colleague of Jeff's who is bringing Health Excellence Plus cash patients empowerment to trade associations for appraisers, HVAC. The list is endless on how we can bring the group business as well as individual to all the business members of trade associations. So come back next week.
All right, very good. I appreciate that. Again, thanks everyone for coming tonight, and we will resume next week. Remember, Monday at noon, I'm going to send a notice out about this meeting, so look for that. It's being sent by MailChimp, so if you don't see it, look for your spam folder. It's going to list the upcoming meeting. So you'll see the preview, the person that Charles was just discussing for next week. And the link for this particular webinar we're just conducting right now will be contained in there. And then sometimes we'll have some links to some other ones from past occasions, come the kind of greatest hits list also, some other ones you can review. All right, very good. I shut the recorder off, so I thanks everyone for coming tonight. Dr. Dale, that was fantastic. I really appreciate the time. And Dr. Tinsley, I'll be up there with you tomorrow in the morning.
Yeah, thank you so much. It was a wonderful talk.
Oh, great. Thanks so much.
Thanks,
Bye,
Tony.
all.
Thanks,
You're
everyone.
welcome.
Thanks, Tony.
Thank you.
Next week.